Hello, Dr. Mintz here. This is an interesting case of a 47-year-old who came in for a chest CT to rule out pulmonary embolism. If you look, you'll see that here's the aorta, here's the main pulmonary artery, the right and left main pulmonary arteries, and multiple pulmonary arterial branches, all of which appear normal, no sign of a filling defect to suggest pulmonary embolism. Here are the chambers of the heart, left atrium, left ventricle, papillary muscle of the left ventricle, and you can even see some of the chordae tendineae, little strings coming from the papillary muscles to the valve leaflets, and you can barely make out the valve leaflets here, partly because they're blurred from motion, because they're moving quite actively during the study, of course. This is the interventricular septum, which is thick, excuse me, but normal for the patient. And this is the right ventricle and right atrium. Okay, so no pulmonary embolism. The patient is short of breath, and is anything going on here? Well, yeah, there are bilateral pulmonary opacities, predominantly in the dependent aspect, and this doesn't look typical for atelectasis. It's not that confluent. It could still be, but if you get up higher here, you see that it looks kind of patchy in this area, for example, and here you see you have kind of a patchy, hazy kind of appearance. So this could be pulmonary edema, or it could be infection, it could be aspiration, very nonspecific, but no PE. Depending on her symptoms, if there's a fever and an elevated white blood cell count, of course it's going to be likely a pneumonia. So as is often the case on a chest CT, we follow it down into the upper abdomen. We always check that for any abnormalities. And there's a very interesting abnormality in this patient. And let me change the windowing a little bit, see if I can bring it out. Okay. So everybody's favorite place, the mesentery. We see the mesentery here, and here's bowel, of course, and you see the mesenteric vessels radiating out to it, and you see this misty appearance, this haziness of the mesentery here that you don't see right over here, for example. It's almost like you could draw a line right around it and say, okay, here it is here, this is abnormal here, this is all normal over here. And if you look a little bit more, you'll see along with the vessels, there are these small little structures, small little masses of some sort, which are actually lymph nodes. Now you can normally have some lymph nodes in the mesentery. These are standing out a little bit compared with elsewhere in the mesentery. So here you see 1, 2, 3, 4, 5, and then you look over on this in a comparable area over here, and you don't really see anything like that. So this is something that we really never saw until we got high-resolution CT. Now that we have that, we see it fairly regularly, and occasionally every couple of weeks or every 2 or 3 weeks, something like that, we'll see something like this. It's nonspecific. It can be the cause of abdominal pain. It may be associated with some disease processes, including carcinoid, or even some cancer elsewhere. It's not fully understood what exactly is happening here and its relationship to cancers. This could be the early changes of lymphoma, but it's kind of nonspecific, and it's associated with a number of different pathologies, and I have posted an article discussing this, Sclerosing Mesenteritis, and that, I think, is the overall catchphrase for it. So if you see haziness in the mesentery, some people just call it misty mesentery, but I think the proper broad term is Sclerosing Mesenteritis, and within that you'll find that there are a couple different descriptive terms. But I think sclerosing mesenteritis is a good term to know, and misty mesentery is just a nice little descriptive term that radiologists are more often familiar with. sclerosing mesenteritis. Another phrase that's used is mesenteric paniculitis, which is a sort of subcategory of that. But I find it a little vague and unclear, but it's important to recognize that if there's haziness in the mesentery, that the term sclerosing mesenteritis comes to your mind, and that you are aware that it may be of very little significance. There are a number of possible causes and associations, including cancers, carcinoid, lymphoma, and that's adequate to appreciate at this point. You can tell also that since this is a CT chest, we don't really go all the way down through it. So heading downward inferiorly here, you see it very clearly, and then it kind of ends. So we don't even know how far down it goes. If you look at the coronals, you can kind of appreciate that a little more. So, very interesting, unusual case of sclerosing mesenteritis. I encourage you to look at the article that I've posted on sclerosing mesenteritis under journal articles on Blackboard, and just look it over. You don't have to read it top to bottom. Look it over, look at some of the images, and kind of get a feeling for the terminology and the different ways it might appear.